Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today, motivational tip I have for you is for you to stop waiting for motivation to come in order to do something about your gender. I'm assuming you're watching this because you're feeling some element, some sense of gender dysphoria, and or perhaps even questioning your gender identity, and you want to do something about it. Maybe you are doing something about it and you want to do more about it. Maybe you are socially transitioning but you want to go into medical transition and you're waiting for motivation to come in, or maybe you are medically transitioning but want to go into surgical transition and waiting for motivation to come in, or maybe you haven't started doing anything at all and you're sitting there and you're waiting for the motivation to come in. So motivation. I don't know how human beings or whoever came up with the stupid concept of motivation and for us to be motivated to do anything in our lives. Now, of course, there's numerous of things we're motivated to do in our life. And a lot of times motivation is that spark, that initial spark. But this concept that in order to do anything, you gotta wait for motivation to come in order to even start is very, very wrong, very inaccurate, and really creates a lot of setbacks for a lot of us. The reality is that the more you know about the situation, the more you know about potential pros and cons, the less likely motivated you're even going to be to begin with. And gender transition is one of the things that actually, by proxy, because you're hearing so many things about it in the media, you're hearing right now a tremendous amount of increase of stories of people who did transitioning, which, by the way, are all valid and important things to hear. But you're hearing them nonetheless, and you're starting to catastrophize and wonder if that's going to be you. And the younger you are, again, I don't work with kids. By younger, for me, would be anybody who's age 18 to probably age 25. If you fall into this category, the more likely you're going to be wondering if you're going to make mistakes, because I see adults age 30 and up less likely wondering if they're going to do transition. Oftentimes, this is something that younger generation tends to ponder. So you're letting that get to you. Then you're also hearing about how challenging transition is, which undoubtedly it absolutely is. Not to scare you, but it absolutely is. It's a lot of work. But you're also hearing this exaggerated things about gender transition, about ranging from you're going to lose everybody to you're going to end up living on a street and you're going to be homeless. And because you're hearing all of the things, well, transition, even though you see the end goal, living more authentic life, being more congruent, alleviation or completely completely wiping out distress of gender dysphoria, all through gender transition. And even though you're seeing all of the things as potential goal, once you hear everything else over here, you're not going to be motivated because all you're hearing is the scary part. And because we're risk averse, and as human beings, we want to increase pleasure and we want to avoid pain. And when you're thinking about this over here, it sounds too painful. You're going to do everything and anything to sabotage your process. Part of that sabotage is going to be to tell yourself, I'm going to do it when I'm going to get motivated. When deep down inside, you know that you're not going to get motivated about a gender transition because it's scary, it requires a lot of you, it's challenging, and it has a lot of things going for it. So as a result, you're going to be unconsciously even sabotaging yourself, again, telling yourself you're going to wait for motivation to come in. And the reality is that it never comes in. Show me one person who or any of you, comment below and let me know if you suddenly woke up and you were like, I'm so motivated to transition, I'm going to do it. Oftentimes, the reason why you went into gender transition, I'm assuming, by far and by large, is because the distress has gotten so strong that you couldn't bear it anymore. Either the severity of dysphoria gotten so worse that you can't bear it anymore, or you just couldn't live like that anymore. Or you felt like you owed it to yourself to live your true authentic self. But something kind of pushed you against the wall where you woke up and you said, enough. I'm done. I'm doing this. This matters to me. But it wasn't motivation. It wasn't motivation. It was the pressure of all of that, of gender dysphoria in one form or another, pushing you against a wall. It's analogous to a battle. It's analogous to a fight. You are in a ring and you're fighting with gender dysphoria. The longer you're coping with your life, with gender dysphoria, the longer you've been fighting with it in a ring. And there comes a time when gender dysphoria has you up against the wall and you decide. And that's the moment when you decide to value yourself and to value who you are and do what's important to you in spite of all of those challenges, in spite of all the difficulties you know, and in spite of potential losses. But it is not motivation. It's not. It is something inside of you that is bigger than gender dysphoria, that is stronger than the strength gender dysphoria has pinning you against the wall, that comes forefront and says enough. Oftentimes, it's sometimes when you hit rock bottom. It's kind of like a rock bottom in gender dysphoria, if you will, where you just cannot deal with it anymore. But again, it is not motivation. So this concept of motivation, we really have to stop thinking about it in this way. Because there's so many things in your life you do without motivation. My classic example that I always tell my clients is, you take garbage out. Don't you? You do. Do you get motivated? Do you get up and you say, I'm so excited to take out garbage out? No. You do so many other routine things every single day because you have to. They're have to things. They're not motivating, but you do them because you have to. Gender dysphoria is also one of the things you have to. It's just that in our society, we haven't been taught yet or educated that we have to. It's a medical thing that has to be dealt with. And because it's not have to, it falls into, oh, but it's a choice. And the longer you've been coping with it, the longer you tell yourself, I can continue to cope. And it doesn't work like that because we know gender dysphoria just never goes away. So the motivation is not going to be there. I want you to first and foremost realize and recognize that you're not just going to be motivated to go through gender transition. Now, I always say that it is a red flag for me personally when I have adults come to me waving transgender flag and saying, I'm so excited to transition, let's get started, how do I do it? That's a very Pollyannish and very naive view about what they're about stepping into. Most people, again, come into my office and they're really hoping. They're probably having their fingers crossed behind their back, hoping, please, Dr. Z, please tell me this is not a gender issue. All the while they know that what I'm going to tell them is going to confirm what you have been knowing all along, by far. Now, there's people that I don't think it's a gender identity issue. I think it's an issue maybe with gender expression or gender role, and I tell them so. Very rarely something else is going on. So the motivation is not going to be there, and we have to recognize that we cannot wait for motivation because that's a form of sabotage. That's a form of self-sabotage that keeps you from living your life. Now, there will be motivation along the way once you do start doing something about your health. And anybody who has been through gender transition will tell you that the motivation was not starting gender transition. Motivation came through the process. And it wasn't always there. And it came maybe in little bursts. And again, it wasn't as frequent, or maybe it wasn't as often. But there were moments when people start hormones and they realize how much better they feel. That process of starting gave them motivation to keep going. You see how motivation is actually, it's a spark that keeps you going, but once you take action, you need action. Action is going to be your fuel. It's your light. It's what you're lighting up. Motivation is going to be what's going to keep you actually going and not giving up. But it's not something that you initially feel, and it's not something initially that's going to come to you magically. It doesn't work like that. And people will tell you once they started to really come out and share this burden, share the secret, and not carry that any longer, they felt a relief. Sure, they were still scared. Sure, there were still things to do in the future, but they felt this relief. And that relief was a motivating factor that helps them to move forward. People will tell you that once they had top surgery to remove their chest, to have more flat or more gender neutral or more masculine or more non-binary appearance. that gave them motivation, that motivated them to keep going, to keep presenting, to keep coming out. Especially if you're non-binary, that gave you motivation to continue to assert yourself when in society there's no markers. When people gender you incorrectly, either male or female, it's like getting punched all of the time. But those little things in transition, the actions you take that make you feel better and confident and assertive, that's the motivation spark that keeps you going. So realize that motivation is not going to happen as the initial spark that is going to propel you forward into transition. So that is a step you just have to take for yourself. And guess what? Transition is huge and large and scary. And depending on what you want to do, depending on whether you want to actually go through medical and even surgical to what extent, it varies. It is challenging. It is big. It's scary. But when you're starting out, don't think about all of those things. Those things are not here yet. Think about the little steps you need to take to affirm to yourself that you are even on the right path. And that will be a motivation to keep moving. You don't need to decide to transition today, call tomorrow, and make all of the surgical appointments. No, it doesn't work like that. And I would never advise for you to do that. But I do recommend for you to take the first steps. Come out. Let that be your motivation. See how you feel. And sure, like I said, it's not always going to be there. There's going to be difficult challenges. You're going to want to give up. But the actionable little steps are going to keep you going. So hopefully, if you're watching this and you are waiting for motivation to come in order to start your gender transition, or maybe you're waiting for motivation to come in to do other things within already your gender transition. Maybe you are already transitioning, but you haven't come out at work yet, but you want to. And maybe you haven't made an appointment for consultation with a surgeon when you want to. Again, whatever your steps are, do not wait for motivation to come in. It's not going to come in. Action is going to be the little motivational steps within your transition, but it's not going to be your initial motivation. So comment below, let me know what steps, what actions, once you've taken them, were actually motivating factors for you. What keeps you going? What kind of things keep you going? I can, of course, summarize a lot of things because I know what keeps you going. Being gendered, being seen for who you are keeps you going. Seeing your body the way you really feel yourself out to be keeps you going. Seeing yourself in the mirror and recognizing yourself keeps you going. But comment below, share your personal keep me going motivational things that are part of your transition once you take those actionable steps. Comment below, let me know, and I'll talk to you all next time.